DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and today we're going to talk about some changes that are coming from FDA in 2023 for us out in the beef industry. Thanks for watching and stay tuned.
Stressors that trigger bovine respiratory disease are all around. So when you spot BRD in your herd, turn to Zuprevo, the fast that lasts. Zuprevo is rapidly absorbed in as little as 45 minutes and lasts up to 28 days. Because in the race against BRD, you need to win. Ready, set, Zuprevo. In case of human injection, seek immediate medical advice. For use in beef and non-lactating dairy cattle only. For prescribing information, talk to your veterinarian or visit Zuprevo.com.
Hey folks, I'm Dr. Dan Thomson. Welcome to DocTalk. It's a pleasure to have you here, and we're starting out 2023 with some changes that are going to be coming from FDA. I'm a veterinarian. I have a part-time appointment at Iowa State University, and I also own a veterinary consulting firm that consults a lot of cattle, from cow-calf to stocker cattle to feedlot cattle all across the United States. And as we look at some of the things that are coming down the pipe from 2023, specifically in June, if you remember back to 2017, and we had the lead up from 2015 to 2017 talking about the veterinary feed directive, and there were people out in front of this really talking to producers because they were going to remove the ability to go in and buy feed grade antibiotics over the counter without a prescription, and trying to get veterinarians connected with producers so that all this could happen. There are two things coming. The first one is going to be a change in how we implant cattle, or an opportunity to look at our re-implanting procedures. And the other one is going to be the over-the-counter antibiotic use that we buy at the farm store, or things of that nature that we buy over the counter. But the first one that I was going to discuss today with us is just picking up some of the things that the FDA CVM is going to clarify what's going on implant labels. And so we use steroid implants. They've been around since the 1950s. They're extremely safe. They're a product that probably 90% of the beef cattle receive. It improves feed efficiency by 10%. It improves average daily gain by even more than that. It's improved our carcass conversions, and there simply is not a more important biological or economical tool that we can pull out of the toolbox to improve performance, feed efficiency, cost of gain than what a steroid implant has done. And so it's kind of confusing to me that they've been around since the 50s, and that we've had most of these modern products now are 30 plus years old. And today we're going to make some changes, or there's some attempt to bring some clarity to what does some of the products out there have a label for different production units. Like some are labeled for dairy calves on milk. Some are labeled for beef calves that are suckling cow. Some are for production units such as grazing calves. Another one might be for backgrounded calves, and then the final one is for feedlot for finishing. And so there are different labels on these products. Some of the products have a label that says that you can re-implant within the same production cycle. Some of them have no reimplant or a negative reimplant label. And therefore, what is coming is that there's now going to have to be some decisions made of which production segment is the calf actually in, and then can we or can we not reimplant them. The example, an animal that comes into a backgrounding situation, gets implanted with an implant, moves to a feedlot, they can be implanted at that point in time with any product that's labeled for the feedlot because they change production units. However, if that same calf comes into a feedlot and is fed like a backgrounder, and then we want to reimplant them within that production unit, there's really a lot of ambiguity there around this definition. And I think that there's going to be a lot of discussion as to what this really means and what this is going to, I know it's going to create some chaos. It's going to create some issues within the industry, but I think that we have to be more clear about our ability to define these, keep them in keep these tools in the producer's hands, keep beef safe, and keep it affordable. Thanks for watching DocTalk. We're going to take a break now. When we come back, we'll talk a little bit more about implants, but we'll also talk about over-the-counter antibiotics.
Nasalgen 3 is a new 3-way intranasal BRD vaccine that offers young calves unrivaled protection against devastating respiratory diseases, including IBR, BRSV, and PI3. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose new Nasalgen 3 PMH, the first and only 5-way intranasal vaccine on the market. Talk to your veterinarian and visit nasalgen.com to learn more.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEXX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey there, welcome back to DocTalk. I'm Dr. Dan Thomson, and we're talking about the June of 2023. Some changes are coming. You need to work with your veterinarian, work with your nutritionist, work with your extension specialist to understand the changes that are coming with steroid implant labeling and over-the-counter antibiotics being no more. So as we were leaving with the steroid implant discussion, the thing to understand is that implants have labels for different production spots. So like I said, dairy calf on milk, suckling beef calf, grazing beef calf, backgrounder, feedlot, all these different production units. As animals switch production units, which implant you use really doesn't matter because you can reimplant in the next production system. Okay? When this is going to cause some discussion, and really there's not clear definition of thou shall or shall not, it's like you should as you read some of the definitions, but really what it's saying is if you have a steer that comes into a feedlot that needs 2 implants, you need to find an implant program or an implant product that states that it is labeled for reimplantation during that production site. So I think that as we move forward, understanding that feedlot cattle that are going to receive 2 implants, we have to have combinations of implants that have the label that said you can reimplant. It's going to cause a lot of discussion and something that we need to keep our eyes on as we move forward. Another one that is coming here in June of 2023 is From now on, all antibiotics will require a prescription, okay? And, you know, we have been able to, in the past, as I said, go and get feed-grade antibiotics, CTC or AS700, and we could get that and use it, and we didn't have to, we just work with our co-op and put it in the supplement. 2017, that changed, where we had to have a veterinary feed directive or a prescription for feed-grade antibiotics. The only loophole that was left as far as controlling antibiotic use and having it underneath the oversight of a veterinarian were the antibiotics that are sold at the farm stores or sold over the counter through distributors, such as penicillin, such as oxytetracycline, long-acting oxytetracycline, different products like that, that we could just buy without a prescription and utilize them. Starting June 11th of 2023, that will no longer be allowed because of the guidance for the industry number 213 from the FDA. From that point forward, from June 11th, 2023, all antibiotics will require a prescription from a veterinarian. So what does that mean? Well, if you haven't had a relationship with a veterinarian in your area, or if you haven't been getting prescriptions filled from veterinarians within your area to receive antibiotics, whether you buy them off of from a distributor or whether you buy them straight from the veterinary clinic, you will now need a prescription, which will include some things such as case definition, such as treatment protocols and treatment outcomes. And we'll get more into this here in the following sessions and kind of tell you how we have done this for other products, which you have to have a prescription for within the beef industry, and we do it on a day-to-day basis. The only thing we're going to be doing now is we're going to be adding some products to the prescription base that we haven't had in the past. I want to thank you for watching DocTalk. When we come back, we'll talk a little bit more about what a VCPR is and what you can expect from your veterinarian when you get your prescription for antibiotics.
Dr. Nels here, folks. We're super excited about this book on hiring. Have you made a bad hire? Have you hired someone you wish you wouldn't have? Are you looking to hire? It's a great short read on helping you in the hiring process. You can find it on Amazon, Kindle, Audible, or find it at drnels.com. Check it out there. We'd love to see you there.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
ValleyVet.com is your one-stop shop for your every animal need. From prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey, welcome back to DocTalk. I'm Dr. Dan Thomson. I'm a veterinarian. We've been doing this show now for 12 years, entering our 13th year with RFD, and want to say thank you so much. Never would have dreamed when we started doing this many years ago that we would still be on the air, and it's because of you all watching, and so just very humbled and very thankful. Now, let's talk about the changes that are coming again here in 2023, June of 2023, and really it's going to be no more penicillin, oxytetracycline, or products like that will be sold over the counter at farm stores or through distributors or such. So you will need a valid VCPR. What is a VCPR? A VCPR is a veterinary-client-patient relationship. And we've gone over this in beef quality assurance, but I'm just going to read so I don't screw it up or miss some point. But a VCPR relationship means that the veterinarian has assumed the responsibility for making clinical judgments regarding the health of the animal and the need of medical treatment, and the client has agreed to follow the veterinarian's instructions. So there's two parts right there. One, the veterinarian knows what's going on your farm. They know what needs to be treated for the animal. And number two, we as producers say we will follow the veterinarian's instructions. So that's the second part of the veterinary-client relationship. The veterinarian has sufficient knowledge of an animal to initiate at least general or preliminary diagnosis of medical condition. This means the veterinarian has recently seen and is personally acquainted with the keeping and the care of the animal by virtue of an examination of the animal or medically appropriate and timely visits to the premise. So we can, right, so when we start to think about VCPR, okay, and I'll follow up with this. The other part of this is the veterinarian has to be readily available or has arranged for emergency coverage for any follow-up or adverse reactions of the animals to the product. So the veterinarian has to be familiar with your premise. The producer has to agree to do what the veterinarian prescribes. The veterinarian has to have timely visits or have seen the animal that it's writing the prescription for. And then the last part of it is if the veterinarian is not close to do the follow-up themselves or be there for adverse reactions, they have to have lined up some sort of coverage to help with the producers that they're writing the prescriptions for. And so generally speaking, what consultants will do or what veterinarians will do is they will develop what they call case definitions. And it will be, if the animal shows these clinical signs, we're calling this foot rot. If these animals show these clinical signs, we're calling it bovine respiratory disease. So if we have bovine respiratory disease, then we will know based on the body temperature of the animal, we'll know based on these clinical signs, and then we'll also grade the severity of the disease. So we have defined the case. We know what it is. We know how severe it is. Now that we know the case definition, now you should be able to go over to when I give all of my producers a treatment protocol that just outlines if we have foot rot and it's a severity score 2, we're going to use this antibiotic, this non-steroidal anti-inflammatory, and this. And so it's really a recipe card to help us keep our treatments consistent so that we can truly evaluate our case outcomes in our process. The understanding the case outcomes then allows us to go back, change the course of the case definition, and also change the treatment protocols. I can't tell you how important it is if you're running a large herd to be able to have these documents, have this relationship with your veterinarian, instead of sitting there wondering which antibiotic to use or which case to use it on. It's just that simple. So I think that the decrease in over-the-counter antibiotics, while it'll be a pain in the neck to begin with, and it's not a money grab by the veterinarians, it is something that's truly going to get the veterinarian more involved in your ranch, and we're going to have better case outcomes in the future. When we come back, we'll talk about some of those ideas of using a veterinarian on your farm or ranch. You're watching DocTalk, and we're glad you joined us.
It's the drive, the passion, the unbridled desire to be the world's greatest. It's the early mornings, late nights, and every hour in between spent grooming the next generation of champions. We're with you through the best times and the tough times. Seeing your horses through inevitable health scares and setbacks you never saw coming. Everything they deserve is here, delivered fast. We'll work hard for you so you can work hard for your dreams.
We are a start-to-finish yard, bring them in at 500 pounds and finish them out to 14 to 1,500 pounds. Max capacity is about 15,000. We begin with the end in mind, which that means it starts from day one coming off the truck. Heard all sorts of stuff about the generics coming out from, a few different companies here and there, but we started working with Vimeda. What I like about working with Vimeda is our rep. He seems like he's just one of us. He knows, he's been in the cattle feeding industry for a long time. He understands where we're coming from, what goes on in the feed yard. So we started implementing Macrocin last July, and we're using it as our first poll treatment. The data shows that success rates on BRD, they're equivalent to the other macrolides that we were using. We just feel fortunate enough, I guess, to get our hands on it, and it works great for us for a first poll treatment. So what really jumped out to us working with by Mita meeting with the rep, Mackerson's affordable. We finally got a product that everybody can afford. We try to do the little things right, whether it's from low stress cattle handling, animal welfare, how we work with the cattle every single day. You know, that's something we really focus on, but when you've got a product like a Mackerson, it's just another assurance protecting you, controlling your BRD from what stressors are thrown out there or what Mother Nature is going to bring to you. This industry, it takes everybody, whether it's working with the nutritionist, it's cowboys working with the veterinarians. Everybody plays a part, and we expect them to do their jobs, but also we expect, you know, the drugs or what we put into the cattle to do their job too. And I think these Bimeda products, they're proving that they're doing the job for us.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and I'm here in Ames, Iowa. We have been in 25 states this last year, working with beef producers, with beef processors, truly cow-calf, stocker, feedlot, processor, retail. It's just a great industry, and it's the people that make up the industry that love our heritage, love our cattle, and love the products that we produce. And so as we're talking about this, FDA has come down with new regulations that'll start in June of 2023. One deals with implanting in different production units, mainly going to affect feedlot cattle. The other one is going to be the over-the-counter antibiotics and the purchasing, which is going to mainly affect ranch, origin, or smaller farmer feeder types that are purchasing penicillin, oxytetracycline over the counter. And starting in June of 2023, that will be no more. You will need a valid veterinary-client-patient relationship. And that we went over will lead to case definitions and treatment protocols that we've talked about for quite a bit of time. Dr. Apley has been on the show to visit with us about that. But, you know, we talk about sustainability of the beef industry a lot. One of the things I am now really working with is the sustainability of veterinary practices. And veterinary practices in rural communities are becoming less and less prevalent. And if you want to have a veterinarian in your rural community or for your beef herds, some things are going to have to change to help the veterinarian. And sometimes the veterinarian is sitting there saying, I don't know if my producers value this. I don't know if my producers want me to do this. And it's going to take a nudge from the producer to ask the veterinarian, hey, do you think you could help us with this and dig in a little bit and understand it? And all of a sudden they develop a program for one or two clients that they can amplify across the practice area. We can't just be going out there on Christmas night doing C-sections in the rain as we think about these types of things and have young people want to come to our communities and be veterinarians. Old doc may be just fine doing this kind of stuff because that's what we're ingrained in doing. But I can tell you that the next generation of veterinarians, if we want them, and if we want them involved, we're going to have to start thinking about things like herd health plans, getting veterinarians involved. That means vaccination protocols, parasite control, nutrition, shelter, fencing, different things that we want to put into this herd health program to help improve, like biosecurity programs, bringing new animals onto the farm, diagnostic surveillance and testing. All of these things we do on regulatory basis, but there are a lot of things that we could be doing with bovine viral diarrhea and things to that nature that would improve your herd health and improve your reproductive efficiency. When we get to repro efficiency, I'm thinking about things like helping with synchronization programs, helping select genetics, helping with pregnancy status and grouping of animals, and really starting to help drive home the value proposition of not carrying cattle through the winter. Veterinarians can help you with culling decisions and marketing options and different types of verification. We know that traceability is coming. I think that the veterinarian will be key because they live in the rural communities. They have the staff, they have the know-how of really being the ones to help in privatizing this traceability platform so that the government doesn't run it. And so as you start to think about this, and you start to think about sustainability of veterinary medicine, one of the things I want to urge both the veterinarians and producers to do is to really think about the value proposition beyond preg checking, beyond semen checking bulls, beyond bangs vaccinating heifers. Think about the things that we can do together through herd health plans, biosecurity, parasite control, total herd management that the veterinarian can help. I know it's going to be a wonderful, wonderful time, and we need more veterinarians. So thanks for watching today. Remember, if you want to find us, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thomson, and I'll see you down the road.
DocTalk is brought to you by Merck Animal Health. By integrating the comprehensive animal health product portfolio of Merck Animal Health with the innovative technologies of All-Flex Livestock Intelligence, we are shaping the future of animal health, resulting in more effective solutions and healthier animals.